Hello, welcome to Cure Disease Kuri channel. My name is Junko Shiozawa and she is my daughter Kuri. Kuri has a very serious disease called DRPLA. It causes the brain to atrophy. Inherited progressing disease. This channel's goal is to find cure for many diseases, and I want to share challenges life. It's great goal. Here is the CureDRPLA newsletter for April 2025. This time, I was involved in 2 of the 4 updates. I'm really happy to share these positive steps with you. First, here's the table of contents. April 2025 newsletter. We are excited to bring updates across different programs. Keep reading to find out more. In this issue, number 1, Nissan Chemical and Sanwa Kagaku formalize agreement to collaboratively develop a drug for DRPLA. Number 2, visiting the Enroll Foundation's laboratory in San Diego. Number 3, Atakia UK will be recognizing and celebrating Cares Week starting on June 9th. Number 4, characterizing DRPLA mouse model and testing potential therapeutics. An update from Dr. Jeff Carroll's group. Nissan Chemical and Sanwa Kagaku formalize agreement to collaboratively develop a drug for DRPLA. Nissan Chemical Corporation and Sanwa Kagaku Kenkyusho, 2 Japanese companies, announced on April 4th their agreement to co-develop SK2407 SN001, which is a preclinical ASO candidate identified through their collaboration for the treatment of DRPLA in Japan. ASOs have emerged as a promising strategy for various neurodegenerative conditions, including DRPLA, by reducing the harmful levels of abnormal proteins that accumulate in cells. Nissan Chemical Corporation and Sanwa Kagaku Kenkyusho have been working on joint drug discovery for an ASO for DRPLA since 2019. Under the agreement, Nissan Chemical will manufacture and provide the ASO, and Sanwa Kagaku Kenkyusho will conduct the preclinical and clinical studies. The 2 companies will also seek partners to develop it outside Japan. CureDRPLA will report updates on the development of this ASO for DRPLA as they become publicly available. It's wonderful news, isn't it? You can find more details on the CureDRPLA website. I've added the link in the description. In May, annual meeting of the Japanese Society of Neurology in Osaka. There, we'll have a DRPLA booth. Researchers and doctors who study brain diseases will come to this event. I introduce CureDRPLA and our Japanese DRPLA family group. I think people from Nissan Chemical and Sanwa Kagaku might visit too. I hope to speak with them directly. Visiting the n-Lorem Foundation's laboratory in San Diego. The n-Lorem Foundation charitably provides experimental ASOs to treatment people with rare conditions that affect very few people in the US, like DRPLA. n-Lorem has started 2 N-of-1 clinical trials for 2 people with DRPLA and has accepted a 3rd patient for treatment. N-Lorem clinical trials are possible because in the US there is a path established by the Food and Drug Administration (FDA) to develop new drugs for rare diseases that affect a very small number of individuals. Paul Compton, one of the co-founders of CureDRPLA, is also a board member of the Enroll Foundation. Last week, he hosted 10 Japanese neurologists at Enroll's laboratory in San Diego. As a parent of a child with DRPLA, Paul was thrilled to discuss potentially commencing N-Lorem clinical trials in Japan using ASOs developed by the Enroll Foundation and what this would mean for the rare disease community. Some of the Japanese neurologists who visited Enroll are Dr. Hidehiro Mizusawa, President Emeritus, President Special Advisor, National Center of Neurology and Psychiatry, Dr. Tojo Nakayama, Project Associate Professor at the Institute of Science Tokyo, Dr. Hiroya Kuwahara, Junior Associate Professor at the Department of Neurology and Neurological Science, and Dr. Jiro Ezaki, MD, Deputy Director, Health Science Division, Ministry of Health, Labor and Welfare, Government of Japan. As mentioned earlier, Paul, the founder of CureDRPLA and a board member of N-Lorem, helped a lot. Thank you. I also joined the meeting as a family representative. We talked not only about DRPLA, but also about other rare diseases. It gave us hope for the future. Atakia UK will be recognizing and celebrating CARES Week starting on June 9th. Join Atakia UK, our partner organization, as they recognize and celebrate the CARES in the Atakia community. Atakia UK will be hosting the following virtual activities. CARES Support Group Meeting. Date June 9th. Time 2 p.m. to 4 p.m. UK time. A great chance to meet other carers and exchange useful advice on caring for someone with ataxia. Mindfulness with Lucy Holland. Date June 11th. Time 1 p.m. to 2 p.m. UK time. Mindfulness sessions are led by Lucy Holland, who volunteers for Atakia UK. The benefits of yoga and mindfulness have been a constant in Lucy's life for over 20 years, and she has been sharing her experience through her teachings since 2017. Self-care for carers with glass knee robots from the Neurotherapy Center. Date June 12th. Time 10 a.m. to 11:30 a.m. UK time. Glass knee robot is a qualified counselor and registered member of the Britain Association for Counseling and Psychotherapy. She currently works for the Neurotherapy Center, supporting people living with neurological conditions, including ataxia, as well as their carers. Please complete the booking form below the register for any and all of the above CARES Week activities. I will post a link in the summary section. Spending time with others who understand our situation feels so comforting. If you live in the UK, please think about joining us. Characterizing DRPLA mouse model and testing potential therapeutics. An update from Dr. Jeff Carroll's group. In this video, we interviewed Elizabeth Borum, a former graduate student working with Dr. Jeff Carroll at the University of Washington. This research group has done a fantastic job in characterizing a mouse model that mimics the human form of DRPLA. Using genetic engineering, scientists instilled the human ATN1 gene into mice with 112 CAG repeats so that the mice would develop DRPLA. ASOs are being tested in these DRPLA mice to determine if they can slow down or reverse DRPLA progression. Watch this video, find out more about their research. For the video, I will post a link in the summary section. Thank you, Aliza and Sylvia. It would be great to see how DRPLA mice are different. One day, I'd love to visit Jeff's lab. So, what did you think of the CureDRPLA April newsletter? I hope to see you again in the next video. So never give up. Tomorrow will be a good day. Thank you very much for watching.